Hi, welcome back to Christine's Health Affairs.
Morning.
Is it morning? No, it's not.
Oh,
It's lunchtime. Oops, that's a bumpy road. We are on our way back to Melbourne again, another hour and 20-minute drive or so. And it's our third one in less than a week, is it?
Pretty much. And then we're going down again Saturday for the table tennis.
Yeah. So we are on our way to the oncologist's appointment. We'll see what happens there. And straight after that, I've got to go and have my markers put in at the radiology centre for the ultrasound. And we're kind of running on a tight schedule at the moment. So between us here, we've got our lunch bag, we've got our coffees made. You got your coffee?
Got my coffee.
Got your coffee. I've made sandwiches for the road. We've got chocolate because we're naughty and we deserve it.
Christine's the best road trip partner, absolutely.
I'm just the best partner.
Oh yeah, okay.
Okay.
I didn't mean to narrow the field.
So yeah, we've got an hour and a half to get there, and then a big rush around to try and see the oncologist and get to our breast ultrasound appointment.
So this is our first meeting with the oncologist.
Yep.
And I think, well, we're going to find out a lot more than what we know now. It's a good chance to ask a lot of questions. Someone actually said in your comments that they used the record function on their phone and just recorded the appointments.
We'll have to ask if we can do that.
Yeah, but it's a good way to remember everything that's said. But we're, I guess, a little anxious about it. I mean, we've found out...
I didn't sleep well last night.
Yeah, we've found out kind of the better news that we reported in the last video, but, you know, I guess we'll get a lot more information in this appointment.
Yeah. So we will keep you updated.
Okay, I'm sitting in the car outside the radiologist next to a very busy road, so apologies if there's a lot of road noise. It's pretty warm down in Melbourne actually. It's a bit overcast, but it's quite warm. Not a bad day to be out really, albeit, you know, not the best to go and have medical appointments for something that you don't want. So Christine's in at the radiologist getting clips put in, or tissue markers I think they call them, where they can basically identify exactly where the cancer is and how large it is, and that gives them information going forward as to how much it's shrunk or grown or whatever you have. We did meet with the oncologist, which I had to Google what that actually meant, and she's basically a cancer case manager, if you like, and coordinates things and discusses things with you, and even offers after cancer care and all that sort of stuff. She's very nice. We had a really good chat with her. We're actually going to go back after we finish here, go back to her consulting rooms and continue our discussion. We have a few things to try and actually work out which is the best way to go, and she's helping us with that. Currently we're thinking we might be best to actually put the chemo off just a week and get the results from the MRI, because they'll have a much better idea of how large the cancer is, because we need to jump one way or another. And apparently the chemo and the stronger drugs they give you first up if your cancer is fairly small, and they try and basically kill it. Some of their drugs have some quite severe side effects and possible long-lasting effects, and you've just got to weigh up the risk versus reward. It is possible that maybe we can just do the chemo for a while before introducing the other drugs and seeing if they're necessary. I think they've decided that the cancer probably is a little bit large to actually take out without trying to shrink it first. So still a lot of things up in the air. The markers will be something that they can then, I presume they'll see on the MRI. They'll get a really good idea of where the cancer is, exactly how large it is. And then we can look at talking with the oncologist again next week. We've got to make some decisions, I guess, and ultimately it's our call. Whether we just say, you know, hit us with the strongest drugs, let's kill it all outright, and we'll take a risk that there won't be any nasty side effects, some of which can be permanent. So we've just got to weigh it all up. But then again, you know, even our shoulder surgeries, there's always risks with surgery, even just with the anaesthetic. So it's not a common thing, but it is something she needs to advise us on. Anyway, enough chatter from me. I've made another coffee. I've made a cuppa for Christine when she comes out. She shouldn't be too much longer. and then we'll battle the busy traffic in Melbourne back to the consulting rooms of the oncologist. Did some pretty cool rally driving to get here. Nothing illegal, mind you, but the little MG we drive goes pretty fast over speed humps without too much trauma. So there you go. All right, well, Kristen will no doubt check in shortly once we finish the appointments and let you know where we're up to next.
So we finished over at the radiology place. I've had my markers put in, had to go and have a mammogram as well, so it took a little bit longer than expected. But me being the ever resourceful kind of gal that I am, and the people that follow my sewing channel will know what I'm like, I've come home with something.
I don't know
gowns.
what this is.
So, you know the gowns that they put on? They're disposable. They threw them out.
Yeah.
But it's really strong.
Oh, okay.
Yeah. So I can see some bags. These are really lightweight, papery type of fabric. But I'm going to make some bags.
Lightweight but strong.
Lightweight, very lightweight. I mean, it's really hard to tear. It stretches more than anything.
The camera's wobbling. Let me just go back here. Righto.
It's really hard to tear, but it stretches.
Okay.
And I reckon I could make some bags. You know, the type that we fold up and put inside our bag? So we're going to recycle some hospital gowns because all they were going to do is throw them out, and yeah, that's wasteful.
How good are you upcycling everything?
Yeah, pretty good.
I might point out we did see some fabric alongside the road put out for...
He wouldn't stop.
I don't think it was what she wanted. I made an executive decision.
All right, we're back at the oncologist's office. We're heading back in there to finish up our appointment.
Yep, it was nice of her to do that.
Yeah.
She basically said, we'll run out of time now, go and do your other appointment and I'll wait around for you. How good's that?
I know.
Yeah.
She's a really nice lady. Yeah.
All right, so are we finishing this video now? There might be more to report later.
There'll probably be more to report.
All right. Yeah,
we'll make a decision.
Back soon.
So we're back home. It has been a pretty exhausting day, and I don't know where we've left off when we were in the car earlier, but we were absolutely buggered. I think Chris did nearly 4 hours of driving today. So we're just going to go and chill, take in everything that we've learnt today. We're still waiting to hear back tomorrow for some scheduling appointments. So once we got all of that out of the way, we'll come back and tell you what happened today and catch you up on everything that's going to happen going forward. So we will catch you again soon. Bye.